Now, sleep is essential for one's health, but it is very much under-researched in South Africa. Because of that, Wits University has launched the Restonic Ezintsha Sleep Clinic. It will conduct research and also help patients with sleep problems and disorders. Let's find out what this exactly is, and maybe if you have some sleeping disorders that may not have been diagnosed. For this conversation, we're joined by Dr. Alison Bentley. Dr. Bentley, good morning. Welcome to the South African Morning. Now, when we talk of sleep disorders, what exactly are we talking about, and the different ways that sleep disorders can actually manifest?
Well, sleep disorders implies that it's an actual disorder. It's not something kind of ethereal. So a lot of people, when I say I do sleep disorders, they say, but isn't everything psychological kind of thing? And no, it isn't. There is this big psychological component to insomnia, for example. So battling to fall asleep at night. So we get anxious about our sleep, and then that can be the psychological component. But there are organic or biological sleep disorders which are very important to find. Otherwise, we're not going to be able to manage. If we think it's a psychological thing, we're not going to be able to manage it. So things like sleep apnea. So if you close your throat at the back at night, not that you're planning to, but if your throat closes at night and reopens with snoring, if you have restless leg syndrome, so your legs are uncomfortable before you go to sleep, or you have what we call the circadian rhythm disorders and your sleep is happening normally, but at the wrong time of the day. So those are kind of the big sleep disorders that we would want to find.
And how do these actually affect your life? How do they affect your health? Apart from the fact that they can actually be very irritating for somebody who's sleeping next to you, especially with the snoring.
Yeah. Well, I think that's common with the sleep disorders, is they irritate the bed partner a lot more than they do the person, because the person who has sleep apnea, there's always this conflict. Like, people go, how do you not wake up with that snoring? Like, how does your snoring not wake you up? And it doesn't. So often the person who has sleep disorder, unless they have a bed partner, they don't know that they have something wrong at night. But what they do know is two types of sleep disorders. Firstly, that they're just unable to get the amount of sleep that they need to feel functional during the day. That would be insomnia. But secondly, they do get 7 to 8 hours, which would be the average, but they wake up in the morning feeling tired, feeling as though they haven't rested, feeling as though they haven't slept, and then feel tired for most of the day. So the consequences, immediate consequences to sleep disorders is always tiredness, fatigue, sleepiness during the day. That's always the immediate consequences. But what's coming more and more into the research literature is how important that restoration is at night that we have. So that's the whole point of sleep, is to restore mind, body, so that we've paid off that credit card of wakefulness. So I kind of always talk about the fact that when you're awake, you're spending on a credit card. And when you sleep, you pay it off to zero. You have to start at zero every morning. And if you don't pay it off night after night after night after night, there is a general rundown in the system. And it presents long-term in things like cardiovascular disease, obesity, diabetes, increased risk of dementia, increased risk of depression, all of those kinds of medical consequences, because the body is just not restoring. And like a car, if you never service the car, eventually something's going to break.
Very serious implications as far as health is concerned, I think more than what the average person would know. So tell us about the clinic and exactly how you work. I believe that your 3 areas of focus are clinical, research and training. Break this down for us. If a person has a problem, a patient comes in, what do you do?
Sure. So there are 3 areas, and really what we're trying to do is pull these 3 areas together in one place. So at the moment, sleep medicine happens, sleep studies, treatment of sleep apnea, which is mainly on a CPAP machine, happens in the medical aid kind of sphere. So if you have money, you can access this kind of thing, and that pretty much breaks my heart. That sleep medicine, if we think it's that important, as far as all those big consequences are concerned, has to be accessible to the general public. And so part of it is to create a clinic where we can offer services to people who don't have money, or patients in the public sector, because there are no sleep laboratories really running, kind of full steam, if that makes sense, and offering a full service for patients in the public sector. Secondly, to do research, and one of the big research projects we need to do is to look at how do we treat patients if we don't have CPAP machines. CPAP machines for sleep apnea cost between 10 and 15,000 Rand each. And most people don't have that amount of money just lying around, not knowing what to do with it. So we have to do some research on that. And the third component is training for doctors, training for the public, educating the public. So all of that to try and put those three things together to create that kind of service, which is not present at the moment in South Africa.
As I let you go, and very briefly, Doctor, there's been a link that's been found between sleep disorders and non-communicable infectious diseases. What is that link, and why is it so important to actually do this study on the African continent?
So the non-communicable diseases are things like diabetes and cardiovascular disease. And when we give information to patients currently, we're giving information that's created in the US or in Europe or in Asia. And those populations are just not the same as ours. So part of the research in that frame is to kind of say, does the same information apply to our patients in South Africa, or is there something different? Because if there is something different, we need to know about it so that we can use that information to better treat our patients.
All right. Well, we thank you so much for your time, and all the best with the research and all the interesting work that's happening. I think, we take our sleep for granted. We think